Well, welcome everybody. Thank you so much for joining us for this fall faculty and staff meeting. Before we get started, I want to acknowledge that today we celebrate Indigenous Peoples Day in Wisconsin and across the nation. I also want to acknowledge that the land our university and school stands on is ancestral Ho-Chunk land. As a School of Medicine and Public Health, we recognize the health inequities faced by Native communities and pledge to learn more and to take action. One way we can all learn more, this is a unabashed commercial message. Please join us for the next installment of NACHIP's Distinguished Lecture Series, which will be taking place on Thursday, October 28th from 11:30 until 1. And we will be blessed with a distinguished lecturer, Dr. Carrie Wabanescom. So please join me for that important upcoming event. So let's move on to our first wonderful agenda item. Next slide, please. And that is the pleasure I have in presenting this year's Fulgert Belzer Award to a remarkable leader and a wonderful, wonderful colleague. The Belzer Award was created a quarter of a century ago, and it honors our most outstanding leaders who have had major impact on the school, on the people and populations that we serve, and on the entire field of academic medicine. It is named in honor of Fulgert Belzer, the transformational chair of our Department of Surgery and the co-inventor of the Belzer solution, which revolutionized the field of transplantation. This is the highest honor that our school bestows, and every one of the recipients, as you can see from the slide, has richly deserved this recognition. Next slide, please. And this year's recipient, Dr. Ellen Wald, is no exception. She has served with distinction as chair of our Department of Pediatrics for more than 15 years and has earned national and international recognition for her personal academic contributions, and especially for her passionate and effective advocacy in advancing the health of children. Ellen's formative years took place in New York. Born in Brooklyn, she completed the majority of her education within just a few square miles. Mathematics at Brooklyn College, medicine at State University of New York Downstate Medical Center, and a residency in pediatrics in King County Hospital. She then completed her fellowship in infectious diseases at the University of Maryland Hospital. Now, the University of Maryland can recognize great talent when it sees it. And so understandably, they invited her to join the faculty. But shortly after, the University of Pittsburgh, one of the strongest academic medical centers at the time and still now, was smart enough to swoop in and recruit her away. And she then flourished for nearly 3 decades there, growing into important leadership roles as chief of their division of pediatrics, allergy, immunology, and infectious diseases, vice chair of pediatrics, and interim chair. Then in 2006, in one of Phil Farrell's many brilliant decisions, she was recruited to join us as chair of our Department of Pediatrics. The rest, as I say, is history, and what a remarkable history. Under her leadership, the vision of the American Family Children's Hospital became a reality, a really great reality for countless kids and their families. The strong research and educational programs in pediatrics became even stronger, gaining depth in traditional areas of excellence, such as asthma and pediatric cancer, and breadth as it moved into other important emerging fields, including health services research. Now, on a personal note, when I came here in 2006, I'll never forget my first meeting with the department. I was shocked to see so few women in positions of leadership. Ellen was the only female chair of any of our 26 departments at that time. Now, that has all changed, thank goodness, but we must not forget the challenges that Ellen faced as a trailblazing pioneer here. To paraphrase Ralph Waldo Emerson, she did not go where the path led, but instead forged a new one and left a trail for many others to follow. On another personal note, I got to say I am in awe. I have deep admiration and respect for Ellen's seemingly effortless balance of commitments. Her complete dedication to her work and our missions is eclipsed only by her even greater commitment to her family. Ellen rarely shares with me the news that she could share about her own personal latest achievements or recognitions, but she never hesitates to talk about her family, including, of course, her academic family, who she's understandably proud of, but also her real family, including her 5 beloved grandchildren. So it is a deep honor and a personal pleasure to present this year's Fulgert Belzer Award to a remarkable leader and a wonderful person and a delightful colleague, Dr. Ellen Wald. Ellen is very fond of saying, I have this burned in my memory, that children are our nation's most precious resource, and she has been one of our school's most precious resources. So thank you so much, Ellen, and congratulations. Earlier last week, I was able to meet with Ellen in person to present her with a plaque commemorating this wonderful recognition of her wonderful achievements. We are really looking forward to the time, possibly in the spring, when we can safely come together in person and have a real party and to really celebrate. But in the meantime, we want to thank Ellen, offer her congratulations. I want to invite everybody to join me in applauding virtually Ellen's contributions to our school, to children's health. And now I'd like to really welcome her to the virtual podium to share a few words with us.
Well, thank you so much. I am truly honored and so grateful for this award. When I applied to medical school so many years ago, my only image of a physician was our family doctor. I had no idea about the world of academic medicine. During medical school, I was drawn to pediatrics, and late in my residency, I became intoxicated with infectious diseases. I was fortunate, as Dean Golden said, to spend many of my years of my earlier career at the University of Pittsburgh, where I had the good luck to work side by side with Dr. Charles Bluestone. Dr. Bluestone is really the father of modern pediatric otolaryngology, and he was very helpful to me in outlining the microbiology of acute sinusitis in children. At the Children's Hospital, as Dr. Golden said, I rose to be chief of the Division of Infectious Diseases. And for many years, I had this very strong conviction that being a division chief was the very best job in the world. However, after a long stint as interim chair at Pittsburgh, I knew that I wanted to have the opportunity to be a chair. The past nearly 16 years have been a peak experience for me, and I have truly loved nurturing and growing the Department of Pediatrics and helping to lead the American Family Children's Hospital. I have worked side by side with many wonderful students, residents, fellows, faculty, colleagues, and staff who have made my day-to-day work almost always joyous and have helped our department to be so successful. I have truly cherished the privilege of caring for patients and families, educating learners, and fostering the careers of our faculty. So I thank you so much, Dean Golden, for this award, and my eternal gratitude to Arnie Wald, who has always been my greatest supporter. Thank you very much.
Well, thank you, Ellen. I will note that about 5 minutes or 4 minutes before we started, there were almost as many panelists as there were people in the audience. But because of this opportunity to honor you and to recognize your great achievements, we are now breaking records here with nearly 200 people online, almost all of whom are sending you messages through the chat. So again, we can't thank you enough for the legacy you're leaving behind, and we are excited about you joining us in the next chapter as an active faculty member after the baton is passed from your leadership role as department chair. I know you'll continue to inspire successive generations of pediatricians and academic leaders. So thank you for all that you've done.
Thank you.
Okay, well, boy, it's a tough act to follow, honoring Ellen, but that's okay. Inspired by Ellen, we are going to focus our attention on another actually wonderful idea that Phil Farrell brought across the finish line, and that is the Wisconsin Partnership Program. We are going to have Amy Kind, who has been instrumental in the leadership team for a number of years now, give a presentation, and I believe she's going to be joined by other members of that leadership team in an exciting update of this wonderful, wonderful component of the SMPH portfolio. Amy?
Thank you so much, Dean Golden, and congratulations, Dr. Wald. It's just been such an honor to get to know you. Very well deserved. So good afternoon, everybody. I am just absolutely thrilled to have the opportunity to present on behalf of the Wisconsin Partnership Program today. Joining me is Dean Rick Moss, Senior Associate Dean for Basic Research, Biotechnology, and Graduate Studies, and the Chair of WPP's Partnership Education and Research Committee. Also joining me is Eileen Smith, the Assistant Dean and Director of WPP for almost 2 decades. I have served on the Partnership Program's Governance Committees since 2017 and have had the privilege of chairing the Oversight and Advisory Committee since 2018. In the coming months, I'm incredibly honored to also assume the role of WPP Faculty Director. It's a pleasure to be here today to share how the Wisconsin Partnership Program is working in partnership with the school, the university, and communities to improve health and advance health equity. WPP's reach extends across our institution and campus in ways that are foundational, and I'm pleased to have the opportunity to share this with you, showing you the value of WPP and the many, many benefits the program brings to the school, the campus, and the state. The Wisconsin Partnership Program is a unique and permanent endowment within SMPH created to improve health and well-being in Wisconsin. Our mission and work are strongly interconnected with the school's mission to advance health and health equity through innovative research, outstanding education, and service to communities. WPP was established in 2002 by the order of the Commissioner of Insurance as a result of the conversion of Blue Cross Blue Shield to a stock insurance corporation and the distribution of proceeds from the sale of the company to the 2 Wisconsin medical schools, the SMPH and the Medical College of Wisconsin. And it's worth noting that over the past 2 decades, over 200 health conversion foundations have been created, but these are the only 2 in medical schools across the country. So through the endowment, the Wisconsin Partnership Program provides the SMPH with tremendous opportunity to extend the Wisconsin idea through the state. The foundation of WPP's mission is built on 3 pillars: research, education, and community partnerships. To date, the WPP Partnership Program has awarded an outstanding 564 grants totaling $265 million across these 3 categories. These investments have been fundamental to the transformation towards an integrated school of medicine and public health. They've also propelled medical and public health research and stimulated innovative solutions to pressing health challenges. We're proud to say that every county in the state of Wisconsin has been touched by work supported by WPP. It's a phenomenal reach that should make us all extremely proud. Furthermore, WPP grantees have gone on to leverage an impressive $644 million from external funders to sustain or enhance their projects. It's a remarkable return on investment. WPP's research investments reach across many SMPH departments and centers. Many of you who are researchers in the audience have been touched by these investments, and to date, more than $138 million in WPP funding supports research, including basic science, clinical and translational research, along with applied public health research. 2 competitive grant programs are available. First, the New Investigator Program, and second, the Collaborative Health Sciences Grant Program, and they're available to all eligible SMPH faculty. There are annual calls for proposals, which are designed to advance novel ideas and new approaches to improve health and advance health equity in Wisconsin and beyond. WPP is most interested in synergistic investments with the potential for large return on investment and large impact. And to date, the new investigator program has supported 72 talented early career SMPH faculty, and the Collaborative Health Sciences Grant Program has established 42 interdisciplinary teams led by senior SMPH investigators. All of this is critically important work striving to solve complex health challenges. WPP's reach and impact extend through substantial institutional and infrastructure investments that benefit faculty here at the school and across campus. For example, we have committed more than $22 million in grant funding to the Survey of Health of Wisconsin, or SHOW, since 2004. In addition, WPP provides institutional support to the Institute for Clinical and Translational Research. To date, we have committed funding of more than $50 million to ICTR, with the intent of providing key infrastructure to benefit many. For example, you may have benefited from WPP's investment in ICTR if you received an ICTR pilot grant. A lot of those monies come through WPP. If you used resources to engage community partners through the Community Academic Partners Corps, also WPP funded, or if you use the Clinical and Health Informatics Institutes, or Chi-Squared's new tools and platforms, also you have benefited from WPP. WPP's education investments have also been foundational to catalyzing and transforming the medical school to a fully integrated School of Medicine and Public Health. The benefits of these investments impact our faculty, the educational experience of our students, and the training of future public health professionals. The Transforming Medical Education, or TME, has been our flagship educational investment, and it has provided $14.3 million in funding for the Forward curriculum, which I'm sure many of you have interacted with. This is the innovative educational model that fully integrates basic, public health, and clinical sciences throughout our medical students' education. The most recent funding cycle has further incorporated health equity concepts into the curriculum. WPP has also provided initial launch funding for the Masters of Public Health program and the Wisconsin Academy for Rural Medicine. And WPP provides ongoing funding for the Population Health Services Fellowship Program and the Preventive Medicine Residency Program. Last year, we established the WPP Scholarship Program, which is a very exciting step. This is a 4-year scholarship created to increase enrollment and retention of medical students from communities that are underrepresented in medicine. To date, WPP has committed $640,000 in scholarship funding. We are thrilled that WPP's widespread educational investments are helping to prepare the next generation of physicians, public health leaders, and we look forward to continuing our commitment to educational innovation and transformation. The partnership program also recognizes that to improve health, we must advance health equity and strive to mitigate health disparities. This goal crosses our entire portfolio and is important to all of our work. In particular, our community grant programs support partnerships that address fundamental social determinants. These are the factors that influence health outcomes across Wisconsin, including within our state's Hispanic, Native American, Hmong, Black, LGBTQ, homeless, rural, and low-income communities, as well as many other communities. A substantial proportion of this funding directly targets health equity initiatives. These grants are led by community organizations and provide a wonderful opportunity for our faculty to lend their voices and expertise as academic partners. I hope it's a mechanism that many of you will consider and partner with community groups to come forward with applications. In March of 2020, the Wisconsin Partnership Program, along with our school, health system, and campus, quickly mobilized to respond to COVID-19. In record time, WPP developed the COVID-19 Response Grant Program to support researchers and community partners who are addressing the immediate challenges of the pandemic. This highly competitive grant program resulted in awards to community organizations and researchers from the SMPH, the School of Veterinary Medicine, the College of Engineering, and the College of Agriculture and Life Sciences for a wide range of innovative projects and studies. More grants that were awarded than can be discussed today, but I'd like to highlight a few led by our SMPH faculty. Dr. David Andes from the Department of Medicine is using a grant to develop novel COVID treatments for monoclonal antibodies. Dr. Nasia Safdar and Daniel Shirley co-lead the SHIELD study to improve COVID protection for frontline healthcare and essential workers. A grant to Dr. David O'Connor in the school's Department of Pathology and Laboratory Sciences and Dr. Thomas Friedrich at the UW School of Veterinary Medicine support their work on genetic surveillance and virus sequencing. As you know, these are key in the ongoing management of the pandemic. Our COVID-19 response grants to community organizations have also been key, supporting a large number of projects, including using telehealth services to prevent COVID-19 amongst people experiencing homelessness, work in communities to ensure access to fresh food and to support the resilience of local farmers, and an initiative that helps Milwaukee doulas adapt to serve Black expectant mothers and families amid the pandemic. Most recently, WPP announced a second round of awards to support researchers and community organizations addressing the long-term consequences of COVID-19. That brings our total COVID investment of funding to 40 grants totaling nearly $6 million. We are pleased that we were able to quickly mobilize in record time in 2020 and to expand our COVID-19 response in 2021 to support the SMPH, the university, and our state at this critical time. The COVID-19 pandemic further illuminated the health inequities that many individuals and communities in our state are experiencing and have been experiencing for years. WPP recognizes the important role it can play to support communities disproportionately impacted by the pandemic, as well as communities impacted by health inequities that are exacerbated by racism and other systemic inequities. Our most recent round of WPP Community Impact Grants provided $6 million to an array of initiatives to advance health equity, including initiatives that support Black men's health, promote the well-being of Black women, and address health impacting barriers to housing, economic stability, and employment. We strive to engage the communities we serve in meaningful ways. So in conclusion, I encourage you to learn more about WPP and our work. Please consider participating in the funding opportunities available through WPP's 2 competitive faculty grant programs, and consider engaging as an academic partner within WPP's community grant programs, the programs in which the community member takes the lead. WPP is proud to work in partnership with our school and our communities towards a shared vision of creating health and advancing health equity in true fulfillment of the Wisconsin idea. So thank you very much for the opportunity to present today.
Thank you, Amy. That was a wonderful overview. It's hard to describe all the amazing aspects of the Wisconsin Partnership Program, but I think that was a wonderful broad overview. I also want to thank you and Rick and Eileen for your outstanding leadership of the program to date. And I really believe the best is yet to come.
Thank you.
I think what we're going to do now is move on with the program, but Amy and Eileen and Rick will be available because we want to spend as much time as we can on the town hall portion of today's faculty and staff meeting with questions and comments. So we'll get to that in a bit, but for now it's time for the annual report. And as is the usual format, I'd like to introduce everybody to our new leaders who have joined us since the last fall faculty meeting, list the many leadership searches that are ongoing, all of which might be a little bit eclipsed by an announcement today about another leadership search on campus. And then I will share with you what I shared with you last year of my to-do list and give myself a report card of how well or not things have worked out. And then I'll share with you my list for the coming year, the things that get me out of bed in the morning, oftentimes before the alarm goes off, because of the excitement of what we can all do together in this academic year. So if we could move to the next slide, please. We've been blessed with a amazing influx of really great, talented and enthusiastic leaders, starting in chronological order in July of this year with Dave Rakel, who came back home after serving as a chair at another fine institution, succeeding Val Gilchrist as the chair of our Department of Family Medicine and Community Health. It's great to have him on board. We were also delighted to successfully recruit Jason Stevenson from our Department of Radiology as our new Associate Dean for Multicultural Affairs for Health Professions Learners. Building on the strong platform that he inherited from Tracy Downs, he's going to expand the scope of services to be even more inclusive of all of our health profession learners, including, of course, medical students. Then, just starting last month, Nazia Safdar joined us as our new Associate Dean for Clinical Trials. She is the new partner with Betsy Nugent. Betsy has done an amazing job in launching what is now going to be formally called the Wisconsin Medicine Institute for Clinical Trials. And Betsy will continue to be the co-leader together with Nazia Safdar. And we're very excited for what the future holds for that important initiative for us, UW Health, and the entire campus. Next slide, please. Then starting today, what a wonderful way to start this day, this week, this meeting, and this year. Shiva Bidar-Silaf, who I think many of you are very familiar with, has been doing a spectacular job at UW Health, leading UW Health's efforts in diversity and equity. She has graciously agreed to double the fund by becoming our inaugural Associate Dean for Diversity and Equity Transformation, with an emphasis on transforming us into an anti-racist institution and doing it in a way that builds on the wonderful synergies between our school and our major clinical partner, UW Health. So it's wonderful to have her on board. And as she gets oriented, I know she'll be preparing for many interactions with many of you individually and collectively, including at an upcoming faculty and staff meeting. Now, soon to come, next Monday, will be Sarah Rothschild as our new executive director of the Wisconsin Medical Alumni Association. Karen Peterson, who has served with distinction in that role for more decades than she wants me to mention, has had her eye on Sarah as a potential successor because both of them work together at the national level through the AAMC. So we are really excited to steal her away from the University of Virginia. Next slide, please. We also have a wonderful upcoming welcoming for two new chairs. Brian Pogue will join us the first of the new year as the new chair of our Department of Medical Physics, coming here from Dartmouth, where he has played a leadership role not only in the College of Engineering, where his current tenure home is, but also in their cancer center. And I'm sure he will, in a similar way, have important partnerships with our Carbone Cancer Center, as well as with many of our departments here. Then starting in early June, Vanessa Sperandio will become the next chair of the Department of Medical Microbiology and Immunology. And we'll be very excited to welcome her here on a permanent basis. She was just visiting last week and will continue to visit as she prepares for the official onboarding. Next slide, please. We have a few searches ongoing, including for the chair of the Department of Neuroscience. We have reached an agreement with a wonderful prospective new chair, and we are now hopefully in the process of finding a suitable position for her very, very talented and productive spouse. So we'll know where things are going with that over the next couple of weeks. We also have an active search ongoing for chair of the Department of Obstetrics and Gynecology. Talk about big shoes to fill. Boy, we're all going to really miss Laurel Rice, but we have a incredible roster of top candidates that will be coming back shortly for second round visits. We also are launching the search for the second ever chair of the Burbee Walsh Department of Emergency Medicine, honoring Azita Hamadani's request to step down from that position. Azita, of course, created that out of the division in the medicine department, and it very quickly has become a major national leader in the field of emergency medicine and really in academic medicine. We are just beginning the process of searching for a new chair of the Department of Pathology and Laboratory Medicine, honoring Andreas Friedel's request that he pass the baton on that one. And as we have discussed just a while ago, Ellen Wald is going to join us as a faculty colleague, but she would like to pass the mantle of chair of the Department of Pediatrics. And that search is in the very earliest stages of getting organized. And Ellen will stay in place until the new chair is on board and ready to accept the proverbial baton. We are doing an internal search for the next Senior Associate Dean for Basic Research, Biotechnology, and Graduate Studies, as Rick Moss moves into, I think it's his 28th iteration of retiring. Seriously, he's been kind enough to continue to work quite effectively as Senior Associate Dean as a rehired annuitant, but now feels it's time to pass the baton. So the announcements just went out very recently, and this will be a focused internal search that we hope to complete in time for Rick's desired transition at the end of the calendar year. Next slide, please. So looking back, this is the actual slide that I showed last year when I described the things that were at that point keeping me awake at night because of all the painful events that were going on at multiple levels with both the pandemic and the epidemic. And so at the top of the list was to accelerate our work on climate change. And by that, we mean an emphasis on evolving into an anti-racist organization and creating a climate where everybody can achieve their full potential. And that's a work in progress. Of course, this is something that we all know requires a long game, but the real excitement is with the successful recruitment of Shiva into the inaugural role. We shouldn't expect that she will solve things overnight, but maybe in a couple of weeks, I'm only kidding, Shiva. But we're very excited to have her as a leader, but all of us have to be leaders on this and think about this every day. And as we go about advancing all of our missions, it should be through a lens of health equity, social justice, and inclusivity. Also on the list last year was to transform our infrastructure for all of our missions from a 2020 before COVID approach into a 2021 after the disease has come under control model. And this also we understood would be a work in progress, but we are already learning lessons from a very harsh and brutal teacher, the COVID pandemic, as to how we can be more efficient, more effective in all that we do. And as just one example, the planning for the new UW Health facility on the east side has undergone a very quick but very effective rebooting, because we've learned from COVID that we don't want to necessarily have conventional waiting rooms where people come in and cough on each other, spreading germs, even as we're trying to help them advance their health. We also set as a goal enhancing the efficiency of clinical trials research on our campus. And kudos to Betsy Nugent. She has done a remarkable job, and kudos to all the people who have worked with her, including others in ICTR, and especially the faculty who've stepped up to the plate in a remarkable turnaround. We are now one of the most desirable sites for clinical trials, and we have to meet the revolution of rising expectations that we will become better and better and better, not only for industry partners, but more importantly for our faculty for investigator-initiated research as well. And we want this to be something that we continue to push the envelope on. And that's why we're so excited for the next iterative phase of this with the creation of our new Wisconsin Medicine Institute. Also last year, we mentioned that we were slowly but surely, with the challenges of the pandemic, beginning to roll out the silent phase of the first ever combined capital campaign that brings together our school and UW Health. So that was last year's list. Let's take a look at this year's list. Next slide, which is strikingly similar, but taking it to another level. We're going to continue our work on climate change and are excited, as I mentioned, about the launch of the new office and the new programs and the new resources that will be dedicated for our Associate Dean for Diversity and Equity Transformation. We are also really excited about two other launches that will get off the ground, will blast off this year, including the Center for Health Disparities Research under the remarkable leadership of Amy Kind, and the new Institute for Diversity Science that Angela Byers-Winston will be leading up. So we want to focus this year on getting those two important new large programs off to a strong start. And we expect great things for both of them in the decades to come. New on the list is that it's very clear to so many of you, and you've made it very clear to me, that there's an imperative that we increase the efficiencies for safe and secure access to very large data sets that can really integrate clinical, health informatics, and basic biomedical data. We've got to do this in the right way and in the safe way. The one thing I'm certain about is that it will take huge amounts of resources to do this. And in the near future, we will be discussing this further, including the growing leadership role of Jomal Matthew is going to really take the lead of pushing this to a whole nother area. She is already leading the Chi-Square effort under the auspices of the Institute for Clinical and Translational Research. But we have bolder ambitions and want to bring in the basic sciences and the basic science departments and other basic biomedical data in a way that will be safe and compatible with university requirements and external requirements for safety. But at the same time, the hope is to make it user-friendly for faculty and for graduate students and other learners. Also this year, we will begin towards the end of the year to transition from the silent phase into the loud and noisy phase, I guess, of our combined campaign. It's off to a wonderful start. Chancellor Blank set the bar very high for us. When Alan and I sought her support, we got it, but also with an expectation that we bring in very large quantities of new resources. And for this type of an approach, the usual metric is that during the silent phase, by the end of the silent phase, we should already have about 40% of our total goal. And we are slightly ahead of the pace with that and look forward to taking it up several notches over the course of the next several years as we go into the very active and visible phase of the campaign as well. So I believe that's the next slide. Let's take a look. Yes, now it's time to open up for questions. Any questions that you have of Amy or the other members of the Wisconsin Partnership Leadership Team, any questions you have of me or other members of the Dean's Leadership Team, it's wide open. And I believe that Kane will serve as the Master of Ceremonies in directing questions accordingly. So Kane, take it away.
Thanks, Dean Golden. I'll mention for everyone that to ask a question, you can use the Q&A feature in Zoom. And I'll echo Dean Golden's comments in the chat. Just kind congratulations pouring in for Dr. Wald on her award. We'll go in the order of today's presentation. So we have a question first for the WPP folks. Can you expand on how the partnership program is approaching maternal and child health funding?
Thank you for that question, Kane. WPP is fully dedicated to maternal child health initiatives across both sides of our portfolio, from research to community. And early this spring, WPP introduced a new maternal and child health funding opportunity to support the community organizations in particular that have developed innovative and effective approaches to help address and mitigate Wisconsin's persistent disparities in infant and maternal mortality. Of course, we all know that these disparities are not acceptable, and we need to continue to press forward towards solutions. So our WPP team engaged more than 70 stakeholders across many sectors, including representatives from governmental agencies, the Department of Health Services, included there philanthropy, academia, and nonprofits to gather input for the program. And certainly, as I said, we know this challenge has existed for too long, but we were really encouraged by the robust array of interventions that emerged from the communities as well as from the providers within our state. The response has been outstanding. And so many applications came in. They have just been reviewed today, and we will be announcing the awarding of that funding in the coming days. We envision that this funding mechanism will serve as an important step as we continue to strengthen and expand these maternal child health initiatives, and we look forward to continuing our journey in this way. Thanks for the question.
Thanks, Dr. Kind. We'll have a question now about remote work with the dust settling on the remote work, the need for a remote work agreement. What are some of the next steps in this process, and what would you tell someone in the school who really thinks that the university and the institution hasn't fully embraced working from home as a permanent option? Dean Golden.
Well, I'm glad that question came up. And let me give a simple, straightforward, concrete response, and then also a more abstract response. So the simple, concrete one is that the school is a vital component of a university, so we follow the guidance and the expectations of the university leadership. And Chancellor Blank has made it really clear that the starting point is in person, where it can be done safely and where indicated, with some flexibility for considerations of special circumstances. And so that's what we're doing. We're starting out with an assumption that things will be in person to the extent that it can be done safely, and that we will have some flexibility, but the flexibility will be based largely on our needs for advancing our missions rather than individual personal preferences. And I think that makes a lot of sense because first and foremost, the school is a community. And there is an intangible but very real value of being together physically for most people most of the time. There are some exceptions, obviously. But I can tell you that as much as I value this virtual town hall meeting, I wish we were meeting in person. I really do. And I wish that the warm feelings that people are sharing with Ellen could be shared in person. Especially if it could be done safely without a mask so that we could see each other's expressions, both nonverbal as well as verbal. So we are a community. We are also a community of incredibly bright, talented individuals who largely enjoy working together on big picture items. And while certain functions can be done remotely without that much obvious decrement in performance, you do miss out on the incredible value of those chats in the hallway, the stop and chats, the incredible value of what gets said before and after the meeting starts, and the opportunity to just knock on somebody's door or run into them in the hallway and be able to float an idea. And then most importantly, perhaps, we are a service organization. We serve the people of the state, the patients and populations. We serve our learners, and we serve each other. And there are some things that can be served well from a distance, but the vast majority are served even better. So with that in mind, we also recognize that the reality is that because of our success, we don't have enough space. We certainly don't have enough parking. And there are a lot of challenges to having everybody always here together. And there are some functions where some of the time, there might be even greater advantages of working in another site rather than in the wonderful, rich, but bustling environment of the school. So that's why we are open to considering requests on a case-by-case basis. I want to be frank with you, though, that those considerations will largely be based on our commitment to our missions rather than individual personal preferences. We will not force people to work remotely if they don't want to, but if somebody really wants to work remotely, the lens that we'll look at will be, how will this advance the missions and the commitments of the school to all the people in the populations that we serve? So that's probably more of a rambling than the questioner wanted, but I want to make it clear. We follow what the university tells us is the university approach. And within that umbrella, we are applying a lens that includes our commitments and our obligations to the people and the populations that we serve.
Thanks, Dean Golden. We've had a great question come in for WPP leadership from Dr. McQueen. Would a partnership between academic institutions addressing the global anesthesia crisis in low-income countries through education and research potentially be supported by the partnership program? Would anyone want to take that on?
I can certainly start, but I welcome Rick and Eileen to join me. So thank you for the wonderful questions. Our approach to decision-making regarding the general areas that we fund are guided by our 5-year plan. And the 5-year plan for the Wisconsin Partnership Program right now is very, very focused on health equity. Our mission is to improve the public health needs of Wisconsin, though, and to reduce health disparities through initiatives in research, education, and community partnerships. So the focus on the partnership program is Wisconsin. It's Wisconsin-based. But however, as we make investments in education and research, there's no doubt that the ripples of that investment can expand well beyond the state and could even impact globally in many, many different ways. So we're always happy to talk with stakeholders more if they have questions about what might be within scope for WPP. And there are many, many different options. So thanks for the great question. And certainly I'd invite Rick and Eileen if they want to add.
Well, I would add certainly that the ripple that Amy has talked about actually can travel in the other direction. And so in thinking about proposals such as this, the meeting that's just been mentioned to discuss what you have in mind is really very, very important. Certainly research and education fit within the portfolio of the partnership program. We do keep in mind our responsibility to the citizens of Wisconsin to advance health within the state, but we understand that there will be impact far beyond our boundaries. So let's talk.
Thanks, everyone. We have a question for Dean Golden that sort of wraps into a couple questions. First question, what are some of the goals of this first ever combined capital campaign for SMPH and UW Health? And what is possibly the chancellor's announcement today of her departure? And how will that possibly influence the fundraising campaign for the school?
So let me start with a simple response and then I'll ramble. The primary goal is to raise a boatload of money. We want to raise a real lot of money. So how do we define a real lot of money? $500 million, that's a real lot of money. Now, having said that, and having done market research, focus groups with large scale donors, and surveys of other important constituents, we have developed 3 high priority themes that we believe will be the most attractive lures for bringing in a number of very large transformational donors. This is not at the exclusion of other themes or any ideas. We will not turn away any support for anything related to the school or to UW Health. But the 3 areas that we are focusing on are cancer, women's complex health needs, and kids, children. There is some overlap there because women's complex health includes, for example, breast cancer and uterine cancer and cervical cancer and ovarian cancer, but it also includes pelvic floor disease as well. And with kids, a lot of that could include pediatric cancer, but it can also include asthma and developmental disorders and other things. But I want to make it really clear, it isn't as though this is what we are going to only focus on or go after. Is that we believe that for a number of potential lead donors, these are themes that will really attract them. And we hope to raise money for everything and anything that's going to be of interest to potential donors. But that's where the major billboard equivalents are going to be as we begin to roll it out. I am still trying to get my hands around the news about Becky's transition. She has been a spectacular leader. And for me personally, she's been an amazing mentor. I've learned a lot from her. And while I will miss her sorely, I do not believe that her transition will have an impact on our capital campaign. I think she has given us all the open doors, all the direction, all the support that we needed to get the ball rolling. And now it's really up to me and Alan and the leadership of the UW Foundation and Alumni Association to fulfill Becky's challenge and to cross the finish line successfully. So I'm really sad to be losing Becky, but I don't think it should have any negative impact on our capital campaign.
Thanks, Dean Golden. We're headed toward our last pre-submitted question. That's a question pertaining to your annual report. We got a lot of leadership search updates, a lot of current searches going on. When it comes to these chair searches, why are they such important searches for the school? And what are some qualities in the candidates that you look for in a new department chair?
Well, chair searches are really important because chairs bear the responsibility for recruiting faculty and staff and helping us recruit students. And chairs really are part of the leadership team that really is responsible for fulfilling our missions and achieving our destiny. So what do we look for in department chairs? Well, many of you, especially Rick, have heard me say this a gazillion times, but if you'll allow me to regress to a sports metaphor from my earlier institution, what I look for is a coach rather than an all-star player. I look for someone like a Dean Smith who made the varsity, but was a spectacular coach because of the kind of person he was and the stage he was in his life, where he wanted to recruit great talent, bring them together as a team, and really step into the background and advance their careers and their combined teamwork to achieve great things. And so that's what I look for in department chairs. It's important that they have been down the road successfully and know what it takes to be a successful researcher, a successful teacher. But I'm looking for people who are not necessarily Michael Jordans, the star of the team in terms of research or teaching, but I'm looking for a Dean Smith or a Coach Gard, I would say now, who really wants to build a team and to let the players on the team be in the spotlight, and knows how to bring together talented individuals, to recruit them and give them what it takes to have them coalesce as a successful team. And so that's pretty much my standard. I call it the Dean Smith approach because he was a great role model for me as a leader. So that's what I look for, and what I tell chairs when I recruit them. Maybe I shouldn't be sharing this, but what the heck, you should know what I tell the chairs they should focus on. That there's 3 things that a chair has to do to be a good chair. Number 1, they got to balance their budget. You can't spend money that you don't have, and if there's no margin, there's no mission. So money is not an end in itself, but if you're hemorrhaging money, the ship will not stay afloat, to mix my metaphors. Number 2, you have to maintain engagement and support of your faculty. You'll at times have to make decisions that will upset a few, but if you don't build a consensus, if you don't take advantage of the most precious resource we have here, which is the collective wisdom of our faculty and our staff and our learners, then you aren't going to be successful. So you have to maintain a reasonable degree of support. If people are talking about revolution in the hallways, you won't be able to advance any type of ambitious agenda. And then number 3, most importantly, you have to recruit well, because the future of this institution will be shaped more by the faculty who the chairs recruit than by the chairs or the dean. The future really lies in the hands of the faculty, so recruit well. If you can do all 3 of those, then you'll be good to go. I'll be satisfied, you'll be a good enough chair. If you want to be a great chair, what it takes is from time to time, and you got to know when that time comes up, you have to put aside the best interest of your department and think about what's in the best interest of your school, your university, and the state of Wisconsin. You don't want to every day, every moment, make every decision based on that. But there will be times, if you want to be a great leader and a great chair, where you have to think about the greater good of the bigger organization and the people and populations that we serve, even if it means that it will not be necessarily to the immediate advantage of your individual department.
Thanks, Dean Golden. We had a question come in regarding Shiva's office that will be starting. I wonder if, on first day on the job, not sure how many specifics are figured out, but if she would just be interested in saying a few words about her initial plans and goals for the new office in SMPH in conjunction with her role at UW Health.
Thank you, Kane. Of course, I'll be happy to. So first, thank you. I'm really excited to be at my first town hall and to start experiencing firsthand all the greatness of SMPH. So I think the first thing that I want to say is that there's a lot of work that has been going on in the space of diversity, equity, and inclusion over the past few years. So my plan is to continue supporting those efforts, continuing to have that work move forward. And while that is happening, also spend the next 2 or 3 months really to build upon that work and to really talk to many of you, identify the additional resources and gaps that we need to be mindful of, so that we can really move our work to another level, that level of transformation that Dean Golden really talked about. So again, be mindful that the next 2 or 3 months are going to be time for us to continue to really think about resources and growth for this work, and keep your eye on a lot of communication around the next steps. So there will be definitely much more communication coming to all of you. And I am on board, I'm here. If there are any specific questions, I'm known to be a super emailer. Maybe, not in a healthy way, maybe sometimes a bit 24/7, but please feel free to email me. I will be happy to respond to any inquiries that you have or any suggestions.
So Shiva, if you'll allow me, is that picture to your side a picture of who I think it is?
Yes, it is a picture of myself with President Obama,
Wow.
a keeper for sure. Definitely sits on my parents' piano.
So cool. All right, thanks, Shiva. Dean Golden, I turn things over to you. That's all the questions that we have for today.
Okay, well, it's 5:30. I think we were technically scheduled to go to 5:45. So I'm sorry to disappoint people by giving you all an extra 15 minutes for enjoying the evening or continuing with your work or whatever. Thank you all so much for joining us. And please feel free to send in suggestions for any particular topics or areas that you'd like to have presented in our future faculty and staff meetings. Until then, stay healthy, stay safe, and on Wisconsin. See ya.